Today, our group will be discussing pneumonia, a respiratory disease that affects millions of people every year. And this presentation will cover what pneumonia is, what happens inside the lungs when someone develops the disease, symptoms to watch out for, who is most at risk, and how pneumonia is treated and prevented. Pneumonia is an infection of the lungs caused by bacteria, viruses, or less commonly, fungi. This infection leads to inflammation of the alveoli, the tiny air sacs responsible for oxygen exchange. Instead of being filled with air, what happens is the infected alveoli will fill with fluid, mucus, and pus, which makes breathing difficult and reduces the amount of oxygen that reaches the bloodstream. Some common symptoms are coughing, shortness of breath, chest pain, tachycardia, fever, chills, and fatigue, rapid, shallow breathing. Severe pneumonia can cause confusion, dangerously low oxygen levels, bluish lips or fingertips, and even respiratory failure, particularly in adults. It can be categorized into several parts, but the two main types we're going to go over is lobar pneumonia and bronchial pneumonia. Pneumonia remains one of the most common and serious respiratory illnesses worldwide in the United States each year. Roughly 1 million adults are hospitalized with pneumonia according to the CDC, and more than 44,000 people die from pneumonia or related complications. Children under 5, adults over 65, and individuals with chronic illnesses, including diabetes, chronic obstructive pulmonary disease, and heart disease, are at a significantly higher risk. There are also clear racial and socioeconomic disparities, with Black and Native American communities experiencing disproportionately higher hospitalization rates. To understand how pneumonia disrupts breathing, let's look at how healthy lungs work. Inside the lungs, air travels through bronchi and bronchioles before reaching the alveoli, millions of tiny balloon-like sacs that surround the capillaries. In healthy lungs, oxygen passes from the alveoli into the bloodstream. Carbon dioxide moves from the bloodstream into the alveoli to be exhaled. The alveoli stay open, elastic, and free of fluid, which allows for that efficient gas exchange to happen. In this illustration, we have a picture of what a healthy alveoli should look like with open air space in comparison to one that has pneumonia and is swollen at the bronchiole. With air space that is filled with fluid or consolidation. There are several different causes of pneumonia, starting with our first example, which is the most common cause of pneumonia. It is the bacterial infection, specifically Streptococcus pneumoniae. Our second example is viral pneumonia, often caused by influenza, RSV, or other respiratory viruses. Our third example is aspiration pneumonia, which occurs when food, liquids, saliva, or stomach contents accidentally enter the lungs. When bacteria or viruses enter the lungs, the immune system responds by sending white blood cells to fight the infection. This causes inflammation, which damages the alveoli and causes them to fill with fluid, pus, and cellular debris. Because the alveoli are no longer full of air, oxygen cannot easily move into the bloodstream. This leads to shortness of breath, low oxygen levels, coughing, wheezing, and rapid breathing. Fever and chills occur because the immune system is actively fighting infection. Here is a 10 magnification of lobar pneumonia that was sketched out. The alveolar spaces are filled with pinkish fluid and cells. The filling is really dense so that the air spaces look solidified. Normally, alveoli appear open and clear, but here they look packed. The alveolar septa also appears thickens because they are congested with blood. It's important to note that lobar pneumonia affects one large continuous area, so the inflammation looks widespread in this 10 magnification. The inflammation of pneumonia causes vasodilation, so the blood vessels widen to increase blood flow. The capillaries fill up with red blood cells, making the septa look darker and thicker. And congestion is a normal part of the inflammatory response to infection. We also have our neutrophils that are present, which are considered the first responders to bacterial infection, and they move from blood to capillaries to alveolar septa, and finally alveolar spaces. There are different treatments for pneumonia, and each depends on the cause. Bacterial pneumonia can be treated with antibiotics. Viral pneumonia can be managed with rest, hydration, fever reducers, and sometimes antivirals. Severe cases may require oxygen therapy, IV fluids, or hospitalization. Prevention plays a major role in reducing pneumonia risks. Some key methods that I'd like to include are pneumococcal vaccines, which are recommended for older adults, younger children, and high-risk groups. Annual flu vaccinations, good hand hygiene, avoiding smoking, and promptly treating any signs of respiratory infections. In summary, pneumonia is a serious but preventable lung infection that interferes with the body's ability to take in oxygen. Understanding how it develops, recognizing symptoms early, and knowing who is at higher risk can significantly reduce complications. With proper medical care and vaccination, most cases can be effectively managed or prevented.